welcome everybody. Welcome back. This is our next SMGR Briefs, and today I'm going to give you a brief introduction to our pain department, that is to say, our sole provider. So introducing Dr. Yulia Rivelis. Yulia's been here for a while, but I thought it's a good time to get her out, let all of you know her and what she does. So it's hard to say welcome, you've been here for a year, but you did take some time off.
I did.
What was that all about?
So took some time off to have a baby. So just coming back off maternity leave. Baby's doing very well. It's great to be back. Missing the baby, obviously, but it's great to be back here and further working towards the department goals.
You grew up on this side of the United States, but you trained back east.
Yes. So I grew up in San Francisco, in the city itself. Went to high school there, and then starting from undergraduate, I went to the University of Pennsylvania, which was in Philadelphia, and then moved to New York City shortly after that. So nearly a decade on the East Coast where I did my training. I did my medical school and residency out there. Residency I did in physical medicine and rehabilitation at Montefiore, and then stayed on for a pain fellowship also at Montefiore.
So I'm going to ask one more thing before we go. How do you like living in Santa Rosa? How do you and your husband like it here?
Well, we actually live in Marin County, so I have a little bit of a commute.
Marin County.
But I do like, my parents live in Calistoga, so I'm very familiar with the Santa Rosa, Napa area. And I luckily have a reverse commute, so can't complain about that.
So let's talk about your training. So your original residency was in physical rehab and
physical medicine and rehabilitation.
What do people normally do after that, if that was the extent of their training?
They can do a variety of things. If they don't specialize, they can work at a subacute facility, an acute rehab facility. They can work on an inpatient floor at a hospital. They can do outpatient clinics. That's kind of why I chose the field, because of its diverse.
So then you went on to do a fellowship?
Yes.
In specifically?
We called it multidisciplinary pain, also interventional pain. So kind of a second layer, adding as far as doing procedures for joints, spine, that kind of thing.
Okay.
And managing pain as a whole by using set injections.
And that's why we hired you. We wanted somebody who had the medical background, the rehab background, but also somebody who could do interventions and procedures. So tell us a little bit about your department here, your department of one at the moment, but what kind of role are you playing?
So I think, starting off, the goal has been to function as a consultant for, the tremendous job that the primary care physicians are doing, together with the physical therapist department, other specialists as well. We're all kind of working together to, in my case, benefit patients who are experiencing pain. We are not really treating acute pain in the sense of post-operative or post-surgical pain. We are kind of dealing with more of an acute and subacute situations. Referrals kind of back and forth. I like to think that I'm kind of functioning as a liaison consultant to, help with any recommendations that I can provide, whether they're medical or therapeutic or interventionally based.
And you do procedures at the ASC?
Yes.
What are your most common procedures?
So those procedures, mainly spine, large joints also. The reason I say mainly spine at the ASC is because the joints, generally I can do at in-house here with an ultrasound. At the ASC, spine, because we focus on fluoro-guided procedures. So those can be epidurals, for both neck, lower back, medial branch blocks, depending on how those go, maybe radiofrequency ablations, geniculate neuropathy, possibly spinal cord stimulators, things like that.
So you're really replicating many of the procedures that we've commonly referred out for, and you're capable of doing all those? Pretty much.
Hopefully, yeah.
Yeah.
As many as I can.
I started by calling this a department because we're probably not going to end with you. And as you said, taking care of pain and pain management is a big pool of patients that are in primary care and other areas. It's just bigger than that. So I think we've talked about growing the department with another layer. We're currently recruiting for an addiction specialist. There may be other things to come in terms of maybe behavioral health components, but is that how you envision a pain department?
Yeah, I think that's, like you said, one level, one layer of it. I think it's primary care, working with neurology, rheumatology. I think physical therapy is paramount when it comes to pain management. I think it's a lot of factors that have to play into it, and I think an addiction specialist is a huge part of it when we're talking about, you know, how we're managing these patients, you know, whether it's opioids or other medications, and I think it's the best kind of management is everybody working together, so.
Good, good. So your office is here in Airway.
Yes.
The referral is simply internal referral pain or pain management. And you're ready to rock and roll.
So we hope.
Yeah, great. Thank you for your
Thank
time.
you.
That's been
Thank
very
you so
helpful.
much.
I just wanted to advertise you out there to know that we have this service for our
Absolutely.
patients.
Happy to help.
Thank you all. I just want to give you one reminder. We do have a virtual all-group meeting next Wednesday, the 13th. I got the date right. And so look forward to not necessarily being in place, but seeing you all at that time. And next week we'll probably plan on doing another video. It's that time of year where you're starting to see articles in the paper about flu shots and RSV shots and COVID shots. So I want to have Dr. Gary Green back, and we'll give you kind of an update and try to simplify that for you. So thanks for listening.
Thank you.